Hello and welcome back to Mirror Interpretation Todorova. Welcome back to my YouTube channel. My name is Ioana and I'm an interpreter and a polyglot. And today I'm making this video. It's a video related to code of ethics. And again, I'm responding to your questions. I don't remember how long ago I received this question, but I did, and I'm apologizing, but I don't remember the name of the person that asked me this question. But I took a lot of time to research this topic, and the reason why is because it's related to code of ethics. The question is, what if the providers don't do their part? They are disrespectful in ethics, cultural sensitivity, and do not follow best practices. So I did made a research about a code of ethics of medical assistant, of a doctor, and what is the Hippocratical oath that was I would say banished, or in 1973 did not work, but how those things are connected in our profession, how they're intertwined in our profession as a medical interpreters. So the most common ethics of interpreter is confidentiality, impartiality, professionalism, accuracy, respect, integrity, and continuing education. If I probably should make a training video between the California Code of Ethics, National Standard Code of Ethics. National Standard break them a little bit more detailed into 12 ethics. However, their main are the same. So confidentiality, impartiality, professionalism, accuracy, respect, impartiality, and so and so. The medical assistant code of ethics, the same, include confidentiality, patient rights. So the patient rights part is this very conflictuous part with the interpreter when you can intervene, and this is when the patient notice that when the interpreter notice, forgive me, that the patient is mistreated, abused, neglect, or in any kind pressured or pushed to do any type of services. I have interpreted for session like that, and I honestly disconnect scrupulously, and I will comment on that. Equality of resources. This is another. We don't have this in medical, but medical assistant have to be. Patient safety. Patient safety is also used, and interpreter must be aware of that. Also, when you position yourself physically on the side of the patient and so on. The conflict of interest is the same rule that we interpreters have to look for. Informed consent. Yes, use an interpreter. Do informed consent. You need a consent to use an interpreter as well. Dealing with opposite sex, or beginning, end of life, and other team ethics. So opposite sex, we have to be sensitive. This is cultural sensitivity, especially if you do in-person interpretation for urology or something like that, or gynecology. It's always to be sensitive. Beginning, end of life, palliative care as well. They are very, very similar code of ethics, and yes, indeed, somewhat different. Now I will read you the code of ethics for a medical or for a doctor. Confidentiality and continuous study for the interpreter as well. Freedom of choice. Freedom of choice is also under the respect for the interpreter. You have to be neutral. You don't have to advise. Being impartiality. I will put that. Honesty, human dignity. honesty for the interpreter in interpretation, human dignity for interpreter, respect for all parties in the session, practice access to medical care for everyone, equality and respect for the interpreter, responsibility for the community, responsibility for the patient, responsibility for the safety. Very similar, with the difference that doctor have, it's more responsible, but also doctor have better lawyers, I would say, and they have this policy that the patient sign for permission and the patient takes the whole risk. So doctors are covered, and use an interpreter, you're not covered if you made an error. This is a big problem for you. I want to talk a little bit about the Hippocratic Oath, and the reason why is that it used to be the most common form of an oath that you take when you finish your studies. It's very famous. They do it in Europe. It's like a ceremony, and this oath is to serve the patient interest. I read the oath. And basically the oath is based on being autonomy, justice, non-maleficence, and the benefit for the patient. This is the base of the oath. However, it was abolished in USA in 1973 because they decided that this oath doesn't include all the necessary code of ethics to protect the patient and to make a doctor being professional. But the rules are more or less the same. Very similar, as you can see. Hereby, I am going to discuss the most problematic encounters or violation of those code of ethics that I have noticed in medical setting. I know this video is not gonna be pleasant for everyone. So if you don't want to be intellectual and talk about controversial things, you can switch and watch someone else, because this is very controversial topic. And also there is a legal loophole here. There is nothing that yet is covering or checking how sensitive the doctors, the culture, the clinics are. And there is not real consequences. And if you get intertwined in some of those non-professional organizations, I have a video actually that I talk about my experience with one of those organizations trying to charge me to do a secretary work for a third-party organization. You can watch the full video actually. The worst that can happen, I think it happened to me, not happened, but was done to me by different organizations, by this specific organization, threatening me, coming to my home and using every information that they had from my work contract to access my Facebook account. And I suffer very severe damages, mental, emotional, and psychological, from this experience. So my best advice would be, if you ever get any kind of very discomfortable, very inappropriate, very weird situation, and if you are in person, do record it on your phone, please. It's your protection, it's for your safety. And if it happened over the phone, I personally withdraw. I say I'm apologizing, I do not feel comfortable serving these sets. It's unprofessional, it's disrespectful to push the patient, but I'm gonna go in detail, and because of that I don't feel comfortable assisting you any further. I notice a lot of nurses or a lot of medical assistants do push elderly or women, trying to threaten them and force them to do vaccination or other medical procedures. I have been witness to that, and I'm pretty sure this happened quite a lot. Unfortunately, the world is not perfect, and the medical industry is a money-making industry. So you're in this big machine, and the best way to get out clear is how I'm gonna share with you. So the first number one thing is impartiality. For example, I noticed this I don't know why, but Medicaid, Medicare, and Blue Cross Blue Shield, there are many organizations that do push elderly to take these panic buttons, especially if these buttons are paid by the insurance, by provider, by governmental assistance like Medicaid. I think it's Medicaid or Medicare, it doesn't matter. But either ways, the providers push the patients to have these panic buttons. And for me, when I say impartiality, sometimes those organizations that provide the button for panic call the patients and insist to start this button, start it, plug it into the wall, and the patients say, I don't want it, give me the address, I want to ship it back. And they're pretending not to get it. I had several sessions where the lady said, I don't want it, I don't need it. Can I ship it back? I don't want to have it. I don't want to play with it, I don't want to plug it, I want to ship it back. For some reason, they are very resilient and very impartial. Every person that works in this panic button clinic organizations that provide this button, their necklaces or bracelets, they are always resilient when the elderly say that they don't want these devices. I cannot tell you why. I cannot explain the reason. I guess there is no control behind, but yes, indeed, there are many, I would say 99% of the times that I interpret for elderly that they did not want this button. The customer care would pressure them and push them and say, but keep it, maybe tomorrow you change your mind, maybe tomorrow you plug it in. And the lady say, I don't want this box in my home, I just want to ship it back. And they continue ignoring that. And it happened to me, a lady said that 25 times during 10 minutes of a session. And the provider disrespected. At this point, I set to myself a rule. If a person says 3 times that they don't want service, or they don't want button, or they don't want procedure, they don't want transfusion, if they repeat it 3 times, I state this. This is my rule. I do it. You do whatever you feel best. I am saying, hello, this is the interpreter speaking. The patient clarify already 3 times that they don't like to receive service. I, as an interpreter, do not feel comfortable to pressure them because they're elderly, and I feel it's disrespectful to do this, and because of that, I would like to withdraw from the session. I don't want to push them. I don't want to be part of this. My apology. I would like to transfer you back to customer service. Usually when I state that, they say, I'm so sorry, yes, I know they said they didn't want it, let's continue. I will help them to cancel the service. I will note that. Some of them, they don't care, they continue to push the person. So I would usually withdraw. This is when the provider is impartial and they want to push service or push something like a button. They would say, no, but it's for their safety. With that, I understand, but the patient say no. And if somebody say no, there is no reason to discuss over it. They have a right to choose, and the provider on the phone should be respectful to that. And if they are not, I am fully comfortable to disconnect from this. I don't have to do anything to do with that. Number 2, where I see that the doctors doesn't follow practices and makes me feel extremely uncomfortable, this is when we talk about vaccinations. I'm not only talking about COVID vaccinations, I'm talking about varicella, pneumonia, and I don't know. There's so many, TB, tetanus, many vaccinations that you can receive nowadays, flu vaccine. That I see that for some reason doctors and nurses are very pushy, even towards a mother with the newborns, trying to oblige them to do vaccinations. And then they say, well, if you don't do vaccination, your baby may die, your baby may be dead. I mean, what mother you are. I had several very This is often, I would tell you, like in a daily basis, 85% of the calls that we're talking about vaccinations, the providers, the nurses, the doctors, the doctor assistants are pushy. They want to force vaccinations for some reason. I don't know why. If the doctor wants a vaccination, she can give to herself as much she wants, but I don't feel like it's respectful. But once again, it happens a lot. If the patients say they don't want it again, once or twice or 3 times, after the second time, I am saying this is the interpreter. The patients say they don't want to receive the service. I don't know if it was interpreted clearly. If you misunderstood, the patient repeated twice. I, interpreter, feel uncomfortable to continue push this service. I feel uncomfortable to serve you. I feel uncomfortable to assist you here. Forgive me. I am breaking protocols and I don't want to lose my job. I'm going to disconnect. I disconnect and I don't worry about it. Usually they know what they're doing. So if you say that one time, they don't do this anymore. However, I feel free to disconnect and I don't feel bad at all about that. And the number 3 thing that I see is cultural sensitivity, and I will tell you the bad consequences when I address this, so you can be ready for it. Cultural sensitivity. This is another topic that is not very developed in the Code of Ethics, not legally, not in USA, unfortunately, despite all this blah 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 that we're democracy, respect and all this. This is not very respectful. There are many insulting questions, especially for Muslim or for people that come from Christianity or they believe in family values and so on. One of those questions is, how many sex partners have you had? Has it been with male or woman or both? I don't understand what kind of usefulness would be this question for anyone. I don't think that this is anyone's business, for first of all. But imagine asking this question for a culture where to be married and virgin is must. Let's say these people from Kazakhstan. And these questions are insulting. And very often they look at me, the interpreters, like I am insulting them. And some of those nurses are pretty nasty about those questions. Americans are not culturally sensitive for other people's culture. This is the truth. They have no idea. They have no knowledge. They have no culture here. I don't want to say they have no culture, but a lot of those people have zero knowledge about what even sensitivity means. They become numb in those fields. So it's very difficult to address this matter. Or, are you male or female by birth? These very culturally insensitive questions, because in some culture this is just unheard, unseen. Do you identify as a transgender? And there are other topics, or how many STDs have you ever had? A lot of people doesn't know what is STI or UTI or STD. And it's very insulting to ask about it as a question. You can get a UTI without having STD, or you can get STD because you're allergic to something. So in most of the culture, the STI tests or UTIs are related to you being impure and dirty and having multiple sexual partners, which is usually very insulting statement inside of this question. So it's just most of the patients will be dishonest. They will be never, because this question is really insulting. It doesn't matter what's the background, Muslim, Christian. It's just these questions are indignifying. They are humiliating. And or how many sexual partners have you had in the last year? I don't see why this could be a business. Maybe I had one partner who gave me 5 STDs, or maybe I had 25 partners that had 0 STDs because you use condom. It just doesn't make any sense to know this number. Yes, they say more you expose yourself to contacts, more you expose yourself to disease. However, these are not culturally sensitive questions. But this is America. And this is in other countries, they don't ask you those type of questions. I never been asked those type of questions. I've been in gynecologists in Europe, in Bulgaria, in Italy. Nobody ever asked me about, another question that a nurse asked me last time I went, and I haven't been to the doctor, but I haven't. The last was this, what kind of contacts do you have? Do you use toys? And do you change your toys with your I mean, these questions that you don't even think about, like how this could affect the doctor, like her performance. Like, why you even, this is just not okay. If I want to share something about toys, I would share it. But if I use toys, I don't think it's the place to discuss it. I don't want to discuss it. And most of people won't discuss it, not because they are not open-minded, because this is not the place. If I use 10 toys, 20 toys, 30 toys, who cares? I can be sick for other reasons, because I have kidney problems, for example, or heart problems, or diabetes, or any other problems. So this could be a light indicator, but I believe that those type of questions should be by choice, and they should have a specific place where you choose to respond or not to respond. And if you say, I don't want to discuss this, they should not ask you 25 humiliating questions. It's not your business. I don't want to share it. I'm here for this service. I want to do urine tests, and you should perform the urine test and let me go. You should not ask me a bunch of questions that I don't want to answer to. So unfortunately, we are culturally not sensitive in USA. The structure of the medical field, the structure of certain clinics and their rules are not sensitive. And there is nothing you can do about it. You are part of it. If you work as an interpreter, you can choose to do certain sessions or not. However, I'd like to let you know that there are certain clients of mine that have requested me beforehand. And some of those clinics do request me. They say to me, this is an abortion clinic. Do you feel comfortable interpreting here? They would ask you. For me, it doesn't really matter. I'm nobody to judge other people's choices. There is terrible reason why a person may need an abortion. Because of that, I'm okay with interpreting in those settings. Some of those clients do ask you. I think one of my clients in all these years, imagine 18 years I worked this job, what is the conflict of interest and your problem as an interpreter here? I address you. I do know that some of those questions, the last one, especially culturally insensitive questions, are insulting. Sometimes I will clarify that this is insulting for their culture, and I will ask, do you still want to ask the question? And all the providers are always, yes, sure, ask the question. I want to know how many sex partner. We're at the cardiology, and they ask, how many sex partner did you had? I don't get it, but it happens. It happens. I have done it, and I have done the job without any hesitation. But the conflict of interest is this for you interpreter, and there is a legal loophole. There is nothing, there is no one law in this country, and I'm repeating, I want to be alive to see a law that protects interpreters. Yes, I want to see a law that protects you from harassment, from misjudgment, from fake, bad review, because there is zero to protect you. And this is why there is a legal loophole, and there is nothing on earth that can protect you, especially if you're a freelancer. You can get in this shady or dark zone and have a problem. The number one thing that I hear, and I hear this on the phone, shut up interpreter and listening to me and do what I tell you, do your job, or you don't do your job. I am a freelancer and I have a right to withdraw, especially if something makes me in extreme distress or discomfort, and I am considering myself mentally disabled to continue. There could be a million reasons. I disagree, agree, it's insulting, it's disrespectful, I'm having a panic attack, I want to drink water, I want to go to the restroom. It doesn't matter. You have a right to take a break from a session that is uncomfortable or that is very, very disturbing for you. The number 2 thing that they say, but I do it for the patient's safety. If the patient doesn't want a panic button, we understand that you provide panic button services, and more patients you force to use it, more money you're gonna do. This is clear. But if the patient doesn't want it, it's not your choice to oblige them to have this service. This is the truth. It's not the company choice. And you as an interpreter can only get a complaint, or you can get these rude responses. This happens too. I choose to remove myself in this situation. I address the matter, or sometimes I just simply say, I'm so sorry, this is the interpreter, I'm no longer able to serve this session, my apology, forgive me, and I disconnect. If it's extremely, extremely uncomfortable, the problem is that you can receive a bad review. This is the truth. You can receive a complaint. Sometimes the line disconnected, I receive a complaint. There is nothing much you can do about this. I rather withdraw than continue dragging a session where I'm gonna push elderly to do something they say they don't want to do. I used to write an emails when I was working for Sirocom. I had several of those very nasty sessions. I would withdraw from the session and I will type an email why I withdraw, and that I'm completely standing behind this reason, behind this choice, and why. Sometimes with the risk to disconnect my contract. This is how conflictuous this could be. And unfortunately, the problem is that there is no law that protects us as an interpreter. The best I think I can do, if I see that something is extremely disturbing, go to the state website and write anonymous complaint. Or you can write a not anonymous complaint. Just hide your personal information like your address and stuff. Because if you complain in the company that you provide services for, they may be in this illegal game too. And then you're gonna have serious troubles like I did. So complaining in a federal level, it gives you more power and more protection. Because in this case, in my situation, I was perpetrated and followed and harassed by my ex-client for quite some time. That was very unpleasant and very wrong situation. So in order to avoid this, I would always advise you to complain in a federal level. That was everything for this. If you noticed that this is how I handle it, please do write me your comments below this video. Thank you for being here. Bye-bye. And also I'd like to let you know, if you want to purchase Spanish English trainings, you can purchase them on the link below. You can also purchase classes, language classes, Italian, Bulgarian, English, and Russian, or interpreting training. And I'm preparing a defense language proficiency test training that you will be able to purchase on the link below. Thank you for being here and have a great day. Bye-bye.